No, ma'am.
Yes?
Yes, ma'am.
Yes, ma'am.
So first what I'll do now is I'll first explain, I'll show you the syllabus for the public health, and I'll show you the syllabus for the optometric instruments also. And after this I'll take class, like I'll try to complete module 1 today. Okay. So just to make a note of the syllabus, one of you, okay. So in module 1 you will be reading about public health optometry. One thing I want to say to you all before I show the syllabus is here, though it is showing like total 7 modules are there, sometimes the title is different. Okay, in modules, when I have gone through the syllabus, what it is like, the title is different, but the content inside that title is the same. So whenever I come across such topics, I'll say to you before only. For example, let's consider concepts and implementations. If there is this title, the matter under this will be same with the other title. For example, community eye care programs. I'm just saying for example, okay. So the syllabus is made in such a way that even though in different modules with different titles, whatever the matter that is coming inside that is same. So in such cases, when I'm teaching the topic, I'll say to you all priorly so that I don't repeat the topic again later on. Okay. So in first module, you will be learning about these, what are the different concepts and implementations, and also the stages of the diseases, dimensions, determinants, and indicators of the health. And in second module, you will be learning about the level of disease prevention. So what are the different levels that we use in preventing a disease, and what is blindness, defining blindness, and the usual impairment. This I hope you all remember when I told in the low vision. However, I'll repeat it again, but I remember teaching you what is blindness and what are the different types of blindness. Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, so the same fact comes here. And in module 3, what is eye in the primary health care? What is the role of the eye care professionals in the primary health care? And what is the difference between clinical and community health care programs? Okay, so and next to module 4, what are the different community eye care programs that an eye care professional will conduct? And what is the community-based rehabilitation program? So that you will be learning in module 4. And in module 5, it's more or less like Vision 2020. Okay, so WHO has defined this program called Vision 2020. So about that you will be learning, and national, what are the different schemes the government is implementing to avoid the blindness in all over the world. That you will be learning in this module 5. Okay, and also in module number 6 is also the same. So what are the different health agencies? Like you will be having these what do we say, we have Red Cross. Okay, so there are certain organizations that are being formed within country or in different countries to promote healthcare among the people. Okay, so what are the different programs that we have presently that you will be learning, and what is the role of optometrist in the public health that you will be learning here. Okay, so and what are the different organizations that are being formed within India and other countries to promote the healthcare among the people. So this is more or less about the organizations and the programs that the government or the non-government bodies are running to promote the healthcare. Okay, and in module number 7, so here you will be learning evaluation and assessment of health programs, and what is the role of the optometrist in school eye health programs. Okay, and also a very basic knowledge you will be getting about what is teleoptometry, what is the use of this teleoptometry, and information, education and communication for the eye care programs. So all this is all you will be learning in these 7 modules of the public health and community health care. So as I informed earlier already that this is a theory and project component. So you will be expected to do the projects on the blindness, NPCB. I'll say what is this NPCB and what is the role of optometrist in public health, and the basics of the teleoptometry and its application in public health. So the project, you need to make a project report on these 4 concepts or the titles that are written here. Okay, so how to make the project report, what all things that you have to include in that, I will be teaching you later on. Okay. Clear? Did you all make a note of the syllabus? At least one of you. So that you can share with your classmates later on. Okay. So now I'll show you the syllabus for the optometric instruments. Okay. So this is a 5-credit course, which is a theory plus practice component. Okay. So the syllabus that you have in the optometric instruments, in module 1, you will be learning about the slit lamp types. Okay. So it's more or less completely about slit lamp examination. What are the different types of slit lamps you have, and the illumination techniques, and what are the color codings or the filters that you have in the slit lamp. So when I asked in the classroom, you all told that you all are expertise in the slit lamp. But let me know if you want me to repeat that, so that I will teach this in the next optometric instrument class. If you want me to repeat, I will do it now. Otherwise, you people have to read it by yourself for the exams.
Repeat, ma'am.
We have optometric instruments, so then I will be teaching slit lamp in the next optometric instruments class. Okay. And second title that you have in module 1 is about the color vision. So we have already discussed about this color vision theories and what are the common color vision disorders and what are the different tests that we do and interpretation. So this is already done. Okay. And next we have about the autokeratorefractometers and about the retinal diagnosis. Okay, so what are the different investigations or the instruments that we use for a retinal diagnosis? So first and foremost instrument that we use is ophthalmoscope. You might have already used the direct ophthalmoscope. Did you ever use that?
No.
Yes, ma'am.
Yes, sir.
You didn't use?
Yeah, yes, no.
Did you use direct ophthalmoscope or not?
Use it, ma'am. Some of us are used.
Okay, fine. So you will be learning, there are two main types of ophthalmoscopes. So what are those types? What is the instrumentation of the ophthalmoscope that you will be learning? And in slit lamp, so the second concept is slit lamp ophthalmoscopy. So along with slit lamp, there are certain lenses called 90D lens and 78D lens. So this, why do we use these lenses? What are the uses of these lenses? You will be learning. Okay. And next you have fundus photography, and then OCT and fundus biomicroscopy. So these all the whatever the instruments that you will be using to see the retinal disorders that you will be learning in this module number 2. Okay. And in module number 3 also, you will be learning about V-scan, electrodiagnostic instruments like ERG, VEP, EOG, FFA, Amsler grid test. So this I think you might have learned already, Amsler grid test. Is it done for you? Yes or no?
No, ma'am.
Okay, fine. Okay, and in module number 4, it's completely for the glaucoma diagnostics. So you'll be learning about the tonometry, different types of tonometries, and you will be learning about gonioscopy, interpretation of the gonioscopy, and HVF test. So these 3 you will be learning in this glaucoma diagnostics. Okay, and in module number 5, it's for the corneal diagnostics, like keratometer you will be learning, and placidus disc you will be learning, and about anterior segment OCT, specular microscope, and what are the different types of lasers, refractive lasers that we perform to the cornea, that you will be learning in this module number 5. Okay, and coming to the module number 6, this is for the cataract diagnostics. So you will be learning about A-scan, PAM, that is potential acuity meter, and next is BAD, that is brightness acuity test. So this you will be learning in this module number 6. Okay, and next last you have module number 7, that is basics of the CT scan and basics of the MRI scan. For this, how many of you have attended this X-ray or you had skill course, right? Some of you have attended X-ray skill course and some of you have attended, what is the other skill course that you have taken in your last semester?
Yes, ma'am. Alumnus taken experiment.
What are those? Some of you have chosen X-ray and some of you have chosen the other one. What is that?
No, ma'am. Almost taken X-ray, ma'am.
You all have taken X-ray only.
Yes, ma'am.
So did you come across this basics of CT scan and MRI scan in that?
No.
No? Yes or no?
No, ma'am.
No, ma'am.
Only X-ray ఎలా చెప్పారని చెప్పారు మ్యామ్ అంతే.
Okay.
పొజిషన్ పై చెప్పారు.
Okay. So this is all the syllabus for the optometric instruments. Okay. So, however, this is a practice component since we don't have many of the equipment in the lab. Okay, so we only have few equipment like Thermoscopes we have, color vision we have, slit lamp we have, and we have tonometer, gonioscopy. I think we have, and we recently got A scan. Yeah, so only these are the instruments that we have in the lab. So for this only the practical will be conducted, but I will teach you the theory for all these investigations. Okay, so later on when you go for the internship, you can come across these instruments and you can learn the practical for these over there. Okay, so clear with the syllabus for the optometric instruments?
Yes, ma'am.
Okay.
Yes, ma'am.
Now coming back to this public health and community optometry. Yeah. So coming back to the syllabus, okay. So when you hear the term this public health and community optometry, what do you actually understand from this terminology? What exactly is this public health, and what exactly do you understand from the term community?
Hospitals and community.
What?
Public health అంటే హాస్పిటల్స్ కదా మ్యామ్.
Public health and hospitals, okay. And
కమ్యూనిటీ అంటే సెక్టార్.
community అంటే
ఒక సెక్టార్ ఒక
okay. Anyone else?
మనం కమ్యూనిటీ ఆప్టోమెట్రీ అంటే మనం పేషెంట్స్ దగ్గరికి వెళ్ళి ట్రీట్ చేయడం, ఒక వ్యాన్ మీద కానీ ఎక్కడైనా మనం క్యాంప్స్ వెళ్తాం కదా మనం, అలా కమ్యూనిటీ ఆప్టోమెట్రీ అంటే దగ్గర ట్రీట్ చేయాలి కమ్యూనిటీ ఆప్టోమెట్రీ అంటారు.
Okay. So partly it is correct. Okay. So what exactly do we understand from this public health or this community is? Public health and community both are same. Okay. So I mean, when did this public health actually came into the existence is in the year of 1980s. Okay, during this 1980s period, it is brought to like it came into the existence, that the importance of this public health. Okay, so what exactly is this public health is? See, people who are living in the urban areas where the hospital facilities are there, and if you get sick, the hospital services are near to you and you can go to the doctor or you can go to the hospital and get treated. Okay, but what about the people who are living in the rural areas, okay, who are not aware about the diseases, where the hospital services are not available? What about them? Okay, so because of this idea, they came into the concept of this public health. Okay, so what exactly is this public health is? So these people, like whoever that are coming under this public health category, like any eye care, it's not only eye care, any healthcare professional, okay, which has all the categories of the healthcare, okay, like eye care, all the sectors of the healthcare professionals, whoever is working, the main purpose or the main aim of this is to to provide the healthcare services to those people who are in need where the healthcare services are not available. That is the motto of this public health. Okay. So the concept of these people is people whoever is working under this public health sector, the patients will not come to them. So these people have to go to the patients and they have to treat the patients in their own house or in their own village. Okay. Clinical healthcare is different and public healthcare is different. Okay, so clinical healthcare in the sense people who if they are not feeling well, they will be going to the hospital and they get treated. But in public healthcare, it is different. Okay, so the people whoever is treating the diseases, they themselves will be going to the villages, they themselves will be going to the patients and they will provide the treatment. Okay, so this is the basic idea about this public health. Okay, so now what I will be teaching you is, now I am saying that clinical healthcare is different and public healthcare is different, or clinical healthcare is different and community healthcare is different. So what are the different factors that will make these two different? Based on what do we differentiate the clinical healthcare system and community healthcare system? Okay, so the 5 factors that differentiate these two is the symptoms, signs, investigations, diagnosis, and action plan. So these are the 5 different factors which will help us in differentiating whether it is a clinical healthcare program or whether it is a public healthcare program or a community healthcare program. So this public healthcare program is also called as community healthcare program. Okay. So the 5 indicators like the symptoms, signs, investigations, diagnosis and the action plan, these 5 will help us in knowing whether that is that category will come under the clinical healthcare program or the community healthcare program. Okay. So now the first indicator that I am saying is symptoms. Okay. If the patient is coming to the hospital and if the patient is giving the history or the complaints of the only person, okay, understand this, okay. So in symptoms indicator, for example, a patient is there, the patient is having headache, okay. So the patient came to the clinic and the patient is giving the history of himself. He is explaining you the complaints that he is facing and whatever the issues that he is facing, he is explaining that to you. That is one category, okay. Now for example, one group, 2-3 group of people, they went to a village, okay, and they are taking the history of all the people who are present in the village, okay, and they are trying to know the issues of all the people who are present in the village. So these are the 2 different categories, okay. So now tell me, where does this first category go into and where does the second category go into? In first case, the person came to the clinic and he or she is giving the history of himself and he is sharing the issues that he is facing for himself to the doctor. In second case, the doctor is going to the rural area and they are taking the history taking of all the villages that are present in that area and also they are trying to find out the problems that the villages are facing. These are the 2 cases. So now we have 2 categories, clinical healthcare and the community healthcare. So where does this first case go into and where does this second case go into?
First one clinical healthcare.
Yeah. And second goes into the community healthcare. Okay. So in the indicator of the symptoms, if the patient is coming to the hospital and if they are giving the history of themselves and if they are sharing the problems of themselves to the doctor, that comes under the category of the clinical healthcare. Okay. In community healthcare, we will be going to the community or we will be going to a particular place and we will be trying to identify the population, the healthcare problems that the population is facing. This is about the symptoms. And next indicator that I have told is signs. Okay, so basically what do we understand from the signs? When we do the examination, whatever the findings that we are seeing in the person will be categorized as signs. Yes or no? Okay. So for example, the person is coming to you and they are saying they are complaining of the redness, and we will be doing the slit lamp examination, and we will be trying to find out what are the different signs that the person is having. So the findings that the examiner is seeing is called as signs. True? And the complaints that the patient is complaining will be categorized as symptoms. You know this, right?
Yes, ma'am.
So now in the indicator of the signs, for example, the same cases. Okay, in first case, the person has gone to the hospital and we have sent him for some diagnosis, or we have conducted some examination for that person, and we found out some signs. That is in first case. In second case, we have gone to the population, okay, and we are finding out what are the different. Okay, so now for example, in symptoms category, I told that we are going to the community and we are trying to find out the population, the healthcare problems that the population is facing. Okay. In continuation to that, let's consider that in that when we went to a rural area, we found out that the people are having majority of the people or the population is facing the problem of diabetes. That is what we understood in the symptoms category. So now in science category, for example, when the person is known that he or she is facing diabetes, there are two cases. That the person will go to the hospital, that the person will go to the healthcare doctor or the hospital, and they'll get the investigation done and they'll get the treatment done. In second case, where people cannot go to the hospital, what we will do now? Okay, so when we found out that one particular village is completely, or most majority of them are having diabetes, we try to come across, or we try to come up with an idea where we will be taking the equipment that is required to perform the test among those people, and we'll come with the outcome. In symptoms case, we will be finding out the problem that the patient is having. In science case, we will be performing the test. If it is a clinical healthcare program, the person will go to the hospital and he or she will get the test done. So what exactly are the signs that are present for that person? In community healthcare program, we will try to take that equipment, we will try to take those devices that we are in requirement to the community care, and we will be performing the investigation, we will be performing those tests there. Yes? Understood?
Yes, ma'am.
Yes, ma'am.
This comes under science. Okay. And third category that we have is investigations. Okay. So basically, what is investigation for us in a clinical healthcare? What exactly is this investigation?
అది పేషెంట్, అది ఒక వ్యక్తికి ఎలా జరిగింది, ఎప్పుడు జరిగింది అని నువ్వు అడుగుతాం కదా మ్యామ్, వాడిని మనం ఇన్వెస్టిగేషన్ అంటాం మ్యామ్. ఏ టైంలో జరిగింది.
Investigations means that is an add-on to the clinical presence. Okay. ఇప్పుడు for example, the person is coming to you and he or she is sharing the problems to you. Okay. And you have performed the test, whatever the test that you have to perform, still you are not able to find out the cause for that, or to find out the diagnosis the person is having. Then further later on we'll be sending them for the investigations. Investigations are the add-ons to our hospital findings. Okay. So in the category of these investigations, if it is a clinical healthcare program, we will be performing a blood. For example, in investigations in a clinical healthcare program, blood test will come, okay, and urine test will come, okay, And we'll also if it is in the eye care program, we'll be sending them for the OCT scan, we'll be sending them for the B scan, we'll be sending them for the A scan. All these are the additional tests that we will be performing on a person to find out the cause for that. Okay, so in a clinical healthcare program, in the category of investigations, what are the additional tests that we are referring the patient for? Okay, so what are the additional investigations that we are sending the patients for to know the cause or to know the diagnosis? That comes under clinical healthcare program. Now, whereas in the community healthcare program, in the category of investigations, it's not the test that we are performing. Okay. So it's the what are the different okay, so let me say this in this way. Okay, so for a community healthcare program, investigations means not the test, but it is the research and it is the statistical analysis that we are doing for that particular region. Okay, so usually in public healthcare, how does it work is, for example, you have found that one particular region is having diabetes, particular region is prone for the diabetes. Okay, so in the category of investigations, see, this is where you will be understanding the difference. If it is a clinical healthcare program, what does the doctor do? Okay, so the doctor will perform the investigations and he or she will give the treatment to only one particular person. For example, in the first case, the person is going to the hospital and the person is explaining the problem to the person and he or she is getting treated or benefited only for himself. But whereas in the public healthcare, in the category of investigations, this public healthcare practitioner will not look only for the healthcare of one person. He or she will be working for the healthcare of the whole village. So for that reason, this person, this public healthcare practitioner, will perform the research in that region. He or she will find out why this region is prone for the diabetes, how many people are present in this village, how many people, so for example 100 people are there in that village. In this 100 people, how many of them are actually having this problem, okay, and what is the cause for this problem in this village, and they will come up with an idea to solve the problem or to give the treatment for everybody in that village. This is what is investigation for the public healthcare practitioner. For a doctor who is practicing in the clinical healthcare, performing a test on one single patient and giving the treatment for that single patient is only the investigation. But whereas for a public healthcare practitioner, investigation in the sense doing the research, doing the data collection and doing the statistical analysis and coming up with the idea why that region is having that particular disease and how many of them in that village is having that particular disease and what is the treatment options that we can provide for that disease. So these will come under the investigation for the public healthcare practitioner. Understood?
Clinical research, ma'am.
You can say that clinical research will not come here because research that you are performing in only clinical areas will be coming under clinical research. But we are not doing it in the clinic. We are going to the community and we are performing the research there.
Okay, ma'am.
Yeah. Understood?
Yes, ma'am.
And next fourth category that we have is diagnosis. Okay. So what is the diagnosis for us? Usually in a clinic, what exactly is the diagnosis? What is diagnosis for us in a hospital? For example, in our
Ma'am,
lab,
finding
only
the
we have the
disease.
lab. Yeah.
I'm finding the disease what the patient is having.
Yeah. So what exactly the person is having, the cause or the finding of that is called as this diagnosis. Okay. So now the same scenario repeats. In first case, the person went to the hospital, he or she gave the complaint, and then we have performed the test, and later on we have sent him for the investigation. So now in diagnosis stage, that is in the fourth stage, what we will be doing, so based on the reports that the patient is getting, we will be finding out the diagnosis. Okay, for example, we have sent the patient for the patient came to the clinic, he or she gave the complaint that that they are not feeling well, and then we have sent them for the blood test. Under the category of investigation, we have sent them for the blood test, and in diagnosis, the person came with the blood test report. So by seeing the blood test report, let's say that the patient is having diabetes, and we have given the diagnosis as the diabetes to that person. This is what happens in the clinical healthcare. But whereas in the public healthcare, we have gone to the village, we have collected the data, how many of them are having the tissues, okay, and then we have performed some research, and we came to know what is the cause for the diabetes. Okay, so now in the diagnosis, what we will be coming in this diagnosis for the public healthcare is, let's say the habit or the lifestyle of the people in that village is making them to get the disease. See, usually in diabetes, it is all about the lifestyle practices, okay? So what type of food that you are eating, at what time you are eating, how much you are eating, all that will make the person to get the diabetes, okay? Now, we have performed the public healthcare practitioner has performed the research in that particular village, and he or she came to know the cause for the diabetes. Let's say the people in that particular village are eating completely rice for all the 3 times in a day. Because of this reason, they are getting diabetes. So this is what is the diagnosis for the public healthcare practitioner. In clinical healthcare practitioner, you are in investigations, you have sent him for the blood test report, and you got to know that the person is having diabetes. That comes under the diagnosis for the clinical healthcare practitioner. But whereas in the public healthcare practitioner, in the category of diagnosis, what is the cause for that particular disease, why they are getting the disease will come under the diagnosis criteria. Understood?
Yes, ma'am.
In clinical healthcare, we don't focus on why the person is getting, because usually 90% of the doctors will just see the report and they'll just say that this is the problem that you are having and this is the treatment that you are using, that you have to use. This is what happens. But in public healthcare, in the terms of diagnosis, we'll come to know the cause for that particular disease in that total community. Okay? And last category that we have is action plan. Okay? So, under the diagnosis, in the first case, we have come to know after seeing the blood test of the person, we have come to know that the person is having the diabetes. So what is the action plan? We will be giving them some medications, that this is a medication that you have to use in a day, you have to use it twice, so that your sugar levels will come down. Or you will try, if the sugar levels are very high, sometimes he or she will be getting insulin also. So this is the action plan. So the giving medications to the particular diagnosis or giving medications or the treatment options to the particular disease the person is facing will be coming under action plan for the clinical health care. Okay. So whereas in public health care, that is not the concept in the action plan for the public health care. Okay. So what we will be doing in the action plan is, we will, now this report we have made, okay, for example, in all these symptoms, signs, diagnosis, investigations, after performing all the research and after performing the cause for all these, now what this public healthcare practitioner will do is, they will be first performing a screening or the awareness program. They'll not be again, they'll go to the village and then they'll explain them to change their lifestyle. They'll give the awareness to the people. So they'll say that these are because of you people having rice 3 times in a day, you people are prone for getting diabetes. So you are advised to change your lifestyle, like by eating roti once in a day, something like that. This public health care practitioner will provide the awareness. In the action plan, they will provide the awareness, and then they will do more and more screening. One second. Sorry. So that will be the action plan for the public healthcare practitioner. Okay. So they'll provide the awareness to the people in that community, and they'll do more and more screening, and they'll try to advise them to change their lifestyle, or they'll try to advise them to change. It's more or less like awareness. Okay. Understood? So this is how all these 5 indications like symptoms, signs, investigations, diagnosis, and the action plan. How does these 5 differentiate the clinical healthcare program and the public healthcare program or the community healthcare program? This is clear for you all?
Yes, ma'am.
Okay. So now next I'll be teaching you what are the dimensions of the health. Okay, so the next concept that you are going to learn is what are the dimensions of the health and what exactly is a health. So when I say health, what do you understand? Can you say me what is health?
Well-being of a person.
What?
well-being of a person.
Okay, can you say it again? I couldn't. Anuja, can you repeat that? Well-being of a person. Okay. And anyone else? What is health?
Emotional well-being.
What?
मैम एक पर्सन का मेंटली फिजिकली पूरी तरह से ठीक होना उसको हम बोल सकते हैं मैम
Okay.
परफेक्ट हेल्थ
Uh-huh. Yeah. So as per the definition of the WHO, what exactly is this health? Okay. So the definition for the health is a state of complete physical, mental and social well-being. Okay. And it's not merely an absence of a disease or the infirmity. Okay. So that is the definition of the health as per the WHO. Okay. So it's the state of the physical, mental and also social well-being. It's not that the person is not having, if the person is not having disease, it doesn't mean that the person is healthy. Okay. The person should be physically, mentally and also socially fit, then only the person is called as a healthy person. Okay, so that is what is the definition of this health. Now, what are the determinants, what are the dimensions of this health? Okay. What are the factors that will affect the health of a person? Okay. So the first dimension of this health is physical dimension. So there are so many dimensions that for this health. So the first category or the first dimension of the health is physical dimension. Okay. So what happens, what is this physical dimension is, it is the perfect functioning of the body. It's the physical performance of the body that will determine the health. Okay. So each and every cell, each and every organ of the body, if it is functioning properly, then that is the physical dimension of the health. Understood? So it's completely the physical state of the person. Okay. So whatever the cells, whatever the organs that the person is having, if all the cells and if all the organs of the person, if they are functioning properly without causing any interruption to the functioning of the body, that is called as the physical dimension of the health. Understood? Yes or no?
Yes, ma'am.
Next category, next dimension of the health is mental dimension. Okay, so what exactly is this mental dimension is the ability of the person to respond to the different experiences of the life. Okay, the person may come across with different experiences. Sometimes the person will be happy, sometimes the person will be sad, depending on the factors or depending on the reasons or whatever that is happening in the life. The way the person is responding to those feelings is that comes under the mental dimension. Okay, so what exactly is this mental health is the ability of the person or the state of the balance between the individual and the surrounding world. Okay, so how the person is able to balance his or her life and also how they are able to balance the surrounding factors. That is the mental dimension. See, in physical dimension, it is all soul our responsibility. It's how our body is responding. It's how our cells are responding, or it's how our organs are functioning. All that comes under physical dimension. But in mental dimension, along with our individual, we also should balance the surrounding or the environmental factors. See, some people, if you are living in a house, if you are living in some colony, they may make some comments, okay, on how you are living, on how you are doing and all. It's how you are balancing and it's how you are taking those comments that will also play a role in your health. Okay, if you are good enough and if you are mentally strong enough, you will be taking it as a positive way and you will try to balance your individual lifestyle and you will try to put these comments aside and you will try to balance your lifestyle. That is what is this mental dimension. Okay, so it is defined as the state of balance between the individual and the surrounding world, a state of harmony between the oneself and the others. This is what is the definition for the mental dimension. I am repeating again. So this mental dimension or mental health has been defined as a state of balance between the individual and the surrounding world, a state of normality between the oneself and the others. Understood? And the third dimension of the health is social dimension. Okay, so what is this social dimension? Is integration within the individual, comma, between each individual and the other members of the society. So how they are integrating, how they are mingling, how they are responding or how they are being with other people in the colony that they are living and in the world that they are living. Okay, so the interaction or the integration that you are making with yourself, that you are making with your fellow beings and that you are making with the other members of the society in the community that you are living, that comes under social dimension. Okay, so that is social dimension. And next dimension is spiritual dimension. Okay, so what exactly is the spiritual dimension is? It is something the person, it balances the both physiological and psychological feelings of the person. Okay, so it might be some people are interested in believing in God and they'll put all the everything, they put themselves completely into this spiritual practice. Okay, like they'll be believing in one particular God and they spend the whole life of them in that particular in praising that God and completely they'll be involving in that. Okay, for them that one God will be one of the physical spiritual dimension. For some people, yoga will be spiritual dimension, meditation will be spiritual dimension. So the spiritual dimension is something which balances the existence of a person in both physiological and psychological factors. Okay, so that is what is the spiritual dimension. Okay, and next is emotional dimension. And next we have another dimension of the health is emotional dimension. So what is this emotional dimension is? How you are emotionally taking the things that are happening in your surroundings. Okay, so that comes under this emotional dimension. One second. please stop.
Emotional dimension. Emotional dimension.
Okay. So emotional dimension in the sense it's how you are taking it's how whatever that is happening to you and whatever the things that are happening in the surroundings, how strongly you are able to balance and how are your feelings, how you are responding to the emotional aspects that are happening in your surroundings and to you. That comes under this emotional dimension. Okay, and next comes the vocational dimension. VOCATIONAL, vocational dimension. See, this vocational dimension is completely related to your work environment. Okay. So, how is your work and how is your workplace is showing an impact on your health? All that will come under this vocational dimension. Okay. So if your workplace is peace enough and if the work environment is good enough, it will not play any impact on your health. Okay. But if the place that you are working, if the environment, like if there is no good ventilation or if the workplace is not good enough, you will be getting physical problems. And if the people that you are working with are not having good friendly nature, you will be having some mental issues with them. Okay, so how this workplace, like the physical work and also the mental pressure that you are getting from your peer group and from your colleagues, that also will be playing a role in your health. Okay, so that is about the vocational dimension. So apart from these physical, mental, social, emotional, vocational dimensions, there are other dimensions also, like philosophical dimension, cultural dimension, environmental dimension, educational dimension, nutritional dimension. So these are the other dimensions which will also play a role in the knowing the state of the health. Okay. Other than these 6 dimensions of the health, so there we have this philosophical dimension, we have cultural dimension, we have environmental dimension, educational dimension, nutritional dimension. So all together, all these dimensions will help us in knowing the health state of the person. Clear? So, and there is something called spectrum of health. Okay. So, what exactly, if we divide the state of being healthy into different stages, from the person born to the person death, okay. So, in between we have a spectrum of health, okay. So, what all things will come under the spectrum of health? First is positive health. Second is better health. Third is freedom from sickness. Fourth is unrecognized sickness. Fifth is mild sickness. Sixth is severe sickness. Seventh is death. So, from the state of being healthy and to the stage of being death, in between, these are the different stages that the person will be going across. First, the person will be having good health, perfect health, and slowly the health will be little, it will become as a better health, and however there will be freedom from the diseases or the sickness, and then slowly they will be getting some sickness which is not recognized, and then mild sickness, and then severe sickness, and the last stage is death. Okay, so this is how the spectrum of health has been divided by the WHO. So this is how the state of the person, how the person from the perfect health and will go to the death. These are the different stages that the person will be going across. Okay. And next concept or the next thing that you have to learn is about the determinants of the health. So we have seen about the dimensions of the health, we have seen the spectrum of the health, and next is the determinants of the health. So what are the different factors that will determine the health? Okay. So there are total 8 determinants of the health. First is biological determinant. Next is behavioral and socio-cultural conditions. Biological determinants. Second is behavioral and socio-cultural conditions. Third is environmental. Fourth is socio-economic conditions. Fifth is health services. Sixth is aging of the population. Seventh is gender. And next is other factors. So these are the different factors that will be determining, that will help us in determining the state of a health. Okay. So what is this biological factor? What is this behavioral and environmental, socio-economic, health services, aging, gender? How does all this will help us in determining health? That I will be teaching you next class. Okay. About these determinants of the health, and next you have to learn about the indications of the health. So if you learn these two, then we are done with this first module. So in next public health class, I will be teaching you about the determinants of the health and also the indicators of the health. Is it clear so far whatever we have discussed today?
Yes, ma'am.
So how do you differentiate between the clinical healthcare program and the public healthcare program that we have discussed? Okay. And what is health? What is the definition of the health as per the WHO? Okay. And what are the dimensions of the health and what is the spectrum of the health? This is what we have discussed. Clear? Okay. So when do you have next public health class? You have it on Friday. Okay. So on Friday, I will be teaching you about the determinants and indicators of the health. Okay. So Ram and Sushmita, take the attendance and keep it with you.
Yes, ma'am.
Okay.
Yes, ma'am.
So if you have any doubts, I can stay back and clear your doubts. Otherwise, I can end the class here. I think after at 11:30 you have mind size class.
Virus class recording.
Yeah, this is recorded.